Your period did not suddenly become wrong because you turned 30. But if a cycle that used to feel predictable is now arriving early, late, heavier, lighter, more painful, or simply unfamiliar, you deserve a clear explanation. In your 30s, period changes are often connected to ovulation, stress, birth control, pregnancy, or changes inside the uterus. That does not mean every changed period is serious, and it definitely does not mean you need to panic after one unusual month. But a repeated pattern is different. A one-time change is one thing, a pattern is another. Maybe your cycle used to arrive every 28 days, and now it is coming every 21. Maybe you are skipping a month and then bleeding heavily when it finally comes. Maybe your cramps feel deeper than they used to, or your period lasts longer, or you are suddenly spotting between periods. These are the changes I want you to notice because your cycle is not just a calendar event. It is information. It reflects what may be happening with ovulation, hormones, the uterus, and sometimes your overall health. The first thing worth considering is pregnancy. This may sound obvious, but pregnancy is one of the most common reasons a period becomes late, unusually light, or different from your normal pattern. And yes, pregnancy can still happen when you are using contraception. No method is perfect, so if pregnancy is possible and your bleeding is unusual, taking a home pregnancy test is often a sensible first step. If the test is positive and you have bleeding with severe pain on one side, dizziness, fainting, or shoulder pain, seek urgent medical care. Now let us move to one of the most common reasons periods change in your 30s. Ovulation is not always happening on the same schedule. Ovulation depends on communication between your brain and your ovaries, and that communication can be affected by much more than people realize. Poor sleep, chronic stress, travel, illness, intense exercise, a major shift in eating, rapid weight changes, difficult season at work, caring for children, caring for parents, grief, a breakup, or simply months of trying to do too much without enough recovery. When ovulation happens later than usual, your period often comes later too. When ovulation does not happen normally for a cycle, the bleeding pattern can become unpredictable. Some people get a very light period, some get spotting, some go longer without a period and then have heavier bleeding later. But I want to be careful here. Stress can affect your cycle, but it is probably stress should never become the answer to everything. If the change keeps repeating, your periods are getting heavier, or if you have new symptoms along with the change, do not let anyone dismiss you with that sentence alone. The next area to consider is birth control and medication changes. This is extremely common: starting a pill, stopping a pill, changing brands, missing pills, using emergency contraception, getting a hormonal IUD, or switching to an implant or injection can all change how and when you bleed. Some people have lighter periods, some have spotting, some stop getting monthly bleeding with certain hormonal methods, and sometimes that is expected. But expected does not mean you should ignore severe symptoms. If you are bleeding heavily, having strong pain, bleeding after sex, or still having troubling bleeding long after the adjustment period, it is worth contacting the clinician who prescribed your method. Then there are changes that may be coming from the uterus itself. This is the category many women start worrying about when periods become heavier, longer, or more painful. Conditions like fibroids, polyps, and adenomyosis can change the way periods feel and look. Fibroids are non-cancerous growths in or around the uterus. They can be associated with heavy bleeding, pelvic pressure, frequent urination, or a feeling that your period has become physically harder to manage. Polyps can sometimes contribute to irregular bleeding or spotting. Adenomyosis can be linked with heavy bleeding and cramps that feel deeper or more intense than before. You do not need to diagnose yourself from a video, but when you notice that your period is lasting longer, that you are passing more clots, or that you are planning your life around pain, it is reasonable to ask whether an ultrasound or further evaluation makes sense. And this is important. Period pain is common, but common does not mean you are supposed to quietly tolerate pain that is controlling your life. If you are missing work, canceling plans, avoiding sex, or dreading your cycle every month because of pain, that deserves a real conversation. Endometriosis is one condition doctors may consider when pelvic pain becomes severe, starts before the period, continues outside the period, or happens during sex or bowel movements. Sometimes a period change is not mainly about the uterus at all. It can be one clue that another hormone system needs attention. PCOS is one example. It can make ovulation less predictable, so periods may be far apart, irregular, or occasionally very heavy after a long gap. Some women also notice acne, new facial or body hair, scalp hair thinning, or weight changes. But one missed period does not mean you have PCOS. What matters is the overall pattern. Thyroid changes can affect the cycle too. This is especially worth discussing if you also feel unusually exhausted, very cold or hot, or notice unexplained weight, hair, skin, or bowel changes. That does not mean every period change requires extensive testing. It means several symptoms appearing together are worth mentioning. And then there is one possibility many women start wondering about: perimenopause. Perimenopause can make cycles less predictable and may come with hot flashes, night sweats, sleep disruption, mood changes, vaginal dryness, or changes in sex drive. But in your 30s, it should not become the automatic explanation for every changed period. Persistent changes still deserve a thoughtful evaluation, especially if you are under 40 or if you are also trying to conceive. Here is the practical part. When can you watch and track, and when should you make an appointment? If you have one unusual cycle after illness, travel, a medication change, or an unusually stressful month, you may choose to track the next cycle and see whether things settle, but make an appointment if the change continues through several cycles, if your periods are becoming consistently irregular, or if your bleeding and pain are clearly getting worse. You should also make an appointment if you bleed between periods, bleed after sex, have a period that lasts more than 7 days, or are dealing with fatigue, shortness of breath, or dizziness that could be related to blood loss, and seek urgent help if you are soaking through pads or tampons every 1 to 2 hours, feeling faint or having severe pelvic pain, especially with a positive pregnancy test. Before your appointment, track your cycle. You do not need a perfect spreadsheet. Just use the Notes app on your phone. Write down the first day of bleeding, how many days it lasts, how heavy it is, whether you are passing clots, how strong the pain feels, and whether you have spotting. Also, note any new birth control, medication changes, weight changes, sleep problems, stress, acne, hair changes, hot flashes, or unusual fatigue. That turns, "My period has been weird lately," into information your clinician can actually use. And maybe the most important thing I want you to remember is this: you know what is normal for you. You do not need to prove that your symptoms are dramatic enough before asking questions. A changing period is not always an emergency, but persistent change deserves an explanation. Heavy change deserves attention. Painful change deserves attention. And a cycle that is making you feel unlike yourself deserves attention. In my next video, I am going to explain when a heavy period is no longer something you should simply live with, heavy bleeding can mean, and what doctors usually look for. This video is for education only, and it is not personal medical advice. But if your body is telling you something has changed, listen to it.